Critical thinking and coding tips for Chapter 24. Okay, our first critical thinking question. What is the time frame related to coding late effects? Our answer. This is often a confusing issue for coders. There is no minimum or maximum time frame to determine whether a condition is a late effect. Coding a late effect code depends solely on physician documentation. They are reported as often as the residual condition warrants medical treatment. As a general rule, sequence the residual condition first, followed by the late effects code. It's important to remember not to also code the acute illness or injury because these are conditions that no longer exist. Our next question, what are the differences in coding adverse effects and poisonings? And our answer, it's critical for the coder to first decide whether the patient is admitted with an adverse effect, which is a correct drug, correct dose, or side effect only, or a poisoning, which is wrong drug, wrong dose, an overdose, or drug interaction with another drug. Now, poisonings have their own set of rules. The poisoning code is always sequenced first, whereas an adverse effect coding, typically the actual side effect is sequenced first. As far as coding poisonings, there are no opportunities to optimize the MSDRG if the poisoning meets the definition of a principal diagnosis. The poisoning rules take precedence and must be sequenced as principal. Okay, now here's some coding tips for this chapter. How a reaction to a prescribed medicine taken in conjunction with alcohol is coded. In this scenario, this is coded as a poisoning because the medication was not prescribed to be taken with alcohol and can be harmful. Okay, the documentation that might be present when determining whether a patient has had an adverse effect. Okay, some common terms that might describe an adverse effect include allergic reaction, drug hypersensitivity, and drug toxicity. Now, hyperbaric oxygen therapy, or HBO. HBO can be used to treat carbon monoxide poisoning. A patient receives pure oxygen by mask, respiratory hood, tent, or endotracheal tube while in a hyperbaric chamber pressurized from 2 to 3 atmospheres absolute. Now, HBO accelerates the process of preventing carbon monoxide from entering the bloodstream, replacing it with oxygen. This helps minimize brain damage that can accompany severe poisoning. HBO can also be used to help heal severe non-healing ulcers. The pure oxygen helps to heal the ulcer more quickly than natural means. And finally, compartment syndrome. Compartment syndrome is an early complication of trauma resulting from compression of nerves and tendons. The pain can be severe and is hard to relieve. If the patient has a cast or a splint, it should be removed immediately. If this does not relieve the pain, a surgical decompression is performed. If not diagnosed quickly, the nerve can be permanently damaged and muscle function can be lost. This can also occur within 12 to 24 hours after the compression has taken place. In the most severe cases, amputation might be necessary. Next, the documentation that might be present when determining whether a patient has had a poisoning. Now, some terms that are commonly used in documentation include drug overdose, drug intoxication, wrong medication, or wrong dose, which all can be interpreted as poisonings. Now, the difference between a drug allergy and a normal side effect of a drug. Now, drug allergies can be life-threatening. Symptoms might include hives, rash, itching, wheezing, swelling of the lips, tongue, or face, difficulty breathing, and rapid pulse. Drug allergies are typically incurable and the drug should be avoided. Allergic reactions are the result of increased sensitivity of the immune system to the drug. An allergic reaction may not occur the first time the drug is taken, but as the body's immune system creates antibodies against the drug, the allergic reaction may appear in subsequent use of the drug. Treatment may include oral or topical antihistamines, nebulizer treatment, and epinephrine injections, and/or treating the symptoms as they occur.